Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the tibial nerve. Tibial nerve is the larger terminal branch of the sciatic nerve. It is formed at the upper angle of the popliteal fossa. It passes vertically through the popliteal fossa. It passes behind the knee joint, passes along the posterior aspect of the leg, and it terminates under the flex retinaculum between the medial malleolus and the calcaneum. So we need to know what is the origin of the tibial nerve. Tibial nerve root value, okay, it is from the ventral division of the ventral rami of L4, L5, S1, S2 and S3. So this is the sciatic nerve. It has two terminal branches. One is the tibial nerve. This is the larger division, tibial nerve, and this is the common fibular nerve or common peroneal nerve, common peroneal or common fibular nerve, common fibular or common peroneal nerve. Okay, we got two components of the sciatic nerve, tibial component and the common peroneal component, and sciatic nerve divides into two. One is the larger one, the tibial nerve. It goes vertically down. It is formed at the upper angle of the popliteal fossa. It goes through the lower angle of the popliteal fossa behind the back of the leg, going to the flex retinaculum. Underneath the flex retinaculum divides into lateral plantar nerve, medial plantar nerve. Okay, if we go to the course, okay, it is formed at the upper angle of the popliteal fossa. Upper angle of the popliteal fossa is located at the junction between the upper 2/3 and lower 1/3, lower 1/3 of the back of the thigh, Okay, we got the beginning from here. Sciatic nerve, tibial nerve, and tibial nerve has another division, common peroneal, common fibular nerve. Okay, it passes, so it goes through the superior angle of the popliteal fossa, superior angle of the popliteal fossa, to the inferior angle of the popliteal fossa. Okay, we got that. So from superior angle to the inferior angle of the popliteal fossa, and then it passes over the popliteus muscle in the course. Okay, yes, still in the course, the tibial nerve passes over the popliteus and under the origin of soleus muscle. Okay. Then passes over the tibialis posterior, covered by the flexor digitorum longus, covered by the flexor digitorum longus. So this is in the leg area. Then it goes in between then this all are going vertically down. Okay, so vertically down the back of the leg, okay, to the ankle, okay, and it passes between the medial malleolus and the calcaneum or calcaneus, okay, bone, covered by the this is the calcaneum or calcaneus, okay, and this is the medial malleolus of the tibia. This is a part of tibia. This is the calcaneum, the largest tarsal bone, okay, covered by the flexor retinaculum, okay, covered by the flexor retinaculum and divides into lateral and medial plantar nerves. This is the lateral plantar nerve. This is the medial plantar nerve. Okay, we got that. So this is the tendo Achilles. Tendo Achilles. Okay, Achilles, that is inserted to the middle third, the posterior surface of the calcaneus or calcaneum. Okay, we got that. The course of the tibial nerve passes over the popliteus muscle. Okay, that is forming the floor of the popliteal fossa, and under the origin of soleus. Soleus has origin from the tibia and fibula. So there is an arch there. Under the arch, we have neurovascular bundle. That bundle contains the tibial nerve and posterior tibial vessels. Okay, in the popliteal fossa, here this nerve is passing over the popliteal vessels from lateral to medial. In the leg, this nerve is accompanied by the posterior tibial vessels. Okay, up to this posterior tibial vessel. This is posterior tibial artery. Okay, so it follows that, and ultimately we are getting the lateral plantar nerve. Lateral plantar nerve that will go to the plantar aspect of the foot. Plantar nerve. And this is the medial plantar nerve. These are the terminal branches of the tibial nerve. Medial plantar nerve. Okay, we got the course and terminal branches of the tibial nerve. Okay, now we go to the muscular branches of the tibial nerve. Muscular branches. Muscular branches. Tibial nerve supplies multiple muscles. It innervates this is the tibial nerve. Okay, tibial nerve. It innervates multiple muscles like the lateral head of gastrocnemius. Lateral head of gastrocnemius muscle. Okay, we got that. We have also innervation to the mid. This is the lateral head of gastrocnemius. You can put it on the lateral aspect. Okay, here we can make it here the lateral head of gastrocnemius. Lateral head of gastrocnemius muscle, and we get here medial head of gastrocnemius muscle. Medial head of gastrocnemius muscle. Okay, we have got other muscles like that of the. It will supply the popliteus muscle. Popliteus muscle. Okay, so it will supply the plantaris muscle. The plantaris. Okay, you can write it here. Plantaris, you can write it here. Plantaris, you can write here. Popliteus. Okay, then the gastrocnemius, lateral head of gastrocnemius, lateral head of gastrocnemius, Okay, we got the muscle here. Is the medial head of gastrocnemius. Medial head of gastrocnemius. Okay, we got the muscle here. Plantaris, popliteus, lateral head of gastrocnemius, medial head of gastrocnemius. Okay, it also innervates the muscle like that of the soleus muscle. Soleus. soleus muscle. It innervates the muscle like that of the tibialis posterior. It innervates the muscle. The flexor digitorum longus, and certainly the flexor hallucis longus, flexor hallucis longus. Okay. Okay, we got the muscular branches of the sciatic nerve. So we can write it here again. Muscular branches, like that of the gastrocnemius, soleus, plantaris, popliteus, tibialis posterior, flexor digitorum longus, flexor hallucis longus. These are the muscular branches. Okay. Then we'll go to the articular branches. Articular branches. This nerve passes over the knee joint. It is in close proximity to the tibiofibular joint, ankle joint. So all the joints get innervation from the tibial nerve. According to Hilton's law, when a muscle crosses a joint, the nerve supplying the muscle should supply the joint and the skin over it. Okay, so we have articular joint in the popliteal region, superior, medial, genicular branch. So that is the superior, medial, genicular branch. Okay, one. Then we'll get the middle genicular branch. Okay, genicular branch. Okay, we have the inferior medial genicular branch. So we have the articular branches. We got the articular branches. The tibial nerve also innervates the interosseous membrane between the tibia and fibula. Interosseous membrane between the tibia and fibula. So it is interosseous membrane. Okay, we got the branches of the tibial nerve. We'll add one more. So we got muscular branch, we got articular branch. Okay, we have cutaneous branches. That is very important. Cutaneous branches. Okay, we have the cutaneous branch. Two. One is the sural nerve. Okay, that is the sural nerve. Okay, sural nerve, and sural nerve is communicated by the sural communicating nerve. Okay, sural nerve receives the. This is the sural communicating nerve. That is a branch of the common fibular nerve. Okay, and another, this sural nerve is accompanied by the small saphenous vein, and sural nerve will innervate the skin, the posterior part of the leg, posterior lower half of the leg, skin, along the lateral border of the foot, okay, up to the little toe, okay. So we got sural nerve. We have another nerve near the calcaneum, okay, near the calcaneum, another nerve just before termination. There is the medial calcaneal nerve, medial calcaneal cutaneous nerve, okay. There is the medial calcaneal nerve. There is a branch of the tibial nerve, the last part of the tibial nerve, close to its bifurcation. We got the cutaneous branches. We got articular branches, we got muscular branches, okay. So we have these branches, articular branches, superior medial genicular, genicular, inferior medial genicular. Also it innervates the other, like the tibiofibular joints, superior and inferior tibiofibular joints, superior and inferior tibiofibular joints, plus it also innervates the ankle joint, okay. So plus it innervates the interosseous membrane. Cutaneous branch, sural nerve, medial calcaneal branch of the sural of the tibial nerve, okay, that is cutaneous. This is also cutaneous, so you can avoid the word cutaneous. Medial calcaneal nerve is good, okay. Both of them are cutaneous, okay. We got the cutaneous branch. Then we have vascular branches. Vascular branches, these usually carry the sympathetic nerve fibers. Vascular branches to the popliteal vessel and the posterior tibial vessel, to the popliteal vessels and the posterior tibial vessels. So we got posterior tibial vessel, they will receive some sympathetic fiber via the tibial nerve, okay. We got the branches of the tibial nerve. Now we learn the clinical anatomy of the tibial nerve injury. So clinical anatomy. Okay. So if the tibial nerve is damaged, usually it is a protected nerve. It is covered by muscles. It is deeply located in the leg. Just over the tibialis posterior, covered by flexor digitorum longus. It passes to the leg under the popliteus, along the lower border of the popliteus, then under the origin of soleus. It is protected, but still it may be damaged by gunshot injury, any type of violence, or any type of trauma. What will happen if this is paralyzed? Then there will be no plantar flexion. So loss of plantar flexion, okay, and there will be loss of inversion. So there will be dorsiflexion, okay, this will be lost, but there will be dorsiflexion that will intact, okay. There will be eversion that will be intact, okay. So these are lost. This will be present, and this condition is called calcaneovalgus. This condition, we call it calcaneovalgus. Okay, we call it calcaneovalgus. Okay, so there will be dorsiflexion, there will be eversion, loss of plantar flexion, and the loss of inversion. Okay, inversion, we got that. This is called calcaneovalgus. Okay, you must know that part. Then we have another problem that is called entrapment neuropathy. Entrapment. Okay, that happened here under the flexor retinaculum. Okay, we call it torsion tunnel syndrome. Torsion tunnel syndrome. Okay, so we got that may happen. There may be pain in the heel, and also in our previous discussion in calcaneovalgus, also in dorsal tunnel syndrome, we have loss of sensation from the sole of the foot. So we have dorsal tunnel syndrome because it is entrapped there. So lateral and medial plantar nerve will not work. So that is condition. It is entrapped here between the calcaneum and the medial malleolus under the flexor retinaculum, and we will have entrapment neuropathy, dorsal tunnel syndrome. It may be relieved by cutting the flexor retinaculum. Okay, that happen, and we have to know the tendon here underneath the flexor retinaculum. Okay, the tendon from anterior to posterior. These are the tibialis posterior. Okay, tibialis posterior, then flexor digitorum longus, and we have the posterior tibial vessel and its branches, posterior tibial vessels. Then we have the posterior tibial artery, then also accompanying vein. Okay, and the tibial nerve and flexor hallucis longus. Okay, so you can easily remember by a mnemonic: Thomas, David, and AN. When I avoid the word artery and nerve, and the Harry. Okay, so tibialis posterior, flexor digitorum longus, artery, the posterior tibial artery, nerve, the tibial nerve, and the flexor hallucis longus. That is the entrapment neuropathy, dorsal tunnel syndrome. Our tibial nerve provides the cutaneous innervation. So in case of tibial nerve injury, there will be loss of sensation, maybe due to dorsal tunnel syndrome, maybe due to damage to the tibial nerve at the upper level. Both way possible. We will have loss of sensation from the plantar surface of the foot or sole of the foot, plantar surface of the foot. Okay, and all the muscle and intrinsic muscles, and loss of function of all the intrinsic muscles of the muscles of the foot, Okay, that may lead to tropic ulcer. So no sensation, people may put anywhere their foot and they may be injured. There will be no pain sensation. There will be chance of tropic ulcer. Okay, so these are the clinical anatomy of the tibial nerve. So that's all about tibial nerve. If you like my video, please support my channel. Please subscribe me, share the information with your friends, and have a nice day. Bye now.